Thank you so much for volunteering to be a part of the Oklahoma Mission of Mercy. I'm Teresa Singleton, the Patient Registration Lead. Patient registration is an exciting area to work because we get to see the patients as they enter the building and prepare to receive their care. Despite having waited for many hours, sometimes overnight, the general mood is one of jubilation. They are thrilled to be there and grateful to get through the door. However, the patients are cold, tired, many are sleep deprived, hungry, and let's not forget, scared. After all, they're coming to see a dentist, and in many cases, they haven't seen one for a very long time, if ever. So here are two important things to keep in mind. First of all, treat everyone who comes through that door as our guest. Greet them warmly and make them feel welcome. We are here for them. We want them to feel special and valued. Second, communication is the key. By communicating what they can expect and answering their questions, you'll help the patients relax and have a more positive experience. The best way for you to prepare to answer their questions is to study the patient information flyer, which you'll find on the OkMoM website. While we try to get this to all the patients in advance, many of the patients will have never seen this. Rarely, anxiety and fatigue may result in a patient or family member directing their anger or frustration at you. If this happens, be compassionate, kind, and patient. Be respectful, even if you're being disrespected. If you have trouble handling someone, don't hesitate to call on me or another lead to help. That's what we're there for. Leads are in royal blue t-shirts and can be found throughout the building. You may also run into language barriers at times. Translators and signers for the hearing impaired will be stationed throughout the building and will be wearing bright yellow vests. Now let's talk about the patient registration process. There are several different tasks involved in the process. As a volunteer, you won't be responsible for every task. You'll be assigned to just one task at a time. You're asked to arrive at the event by 4:30 a.m. During the few minutes before the clinic doors open, I'll be assigning you to one of the tasks I'm about to explain. Most tasks require standing, but a few do allow for sitting, so please be sure to let me know if you need a sitting task for health reasons. Beginning shortly before the clinic doors open at 5 a.m., groups of about 50 people at a time will be led from the pre-event holding area to the clinic entrances. Families with children who are receiving care will be led through the family clinic entrance because they'll be served by the family clinic, which enables us to provide care to both the parents and the children in the same area. All others, including those with children who are not receiving care, will enter through the main patient entrance. As they stand in line approaching the clinic entrance, several volunteers will work together to process the patients. Now, while we want to work quickly and as efficiently as possible to get the patients through the door, we don't want them to feel like herded cattle. So keep that in mind as you walk them through this process. Number one, the first step to the process is to direct anyone not receiving dental care to the family and friends waiting room. If you're assigned to this task, you'll let everyone know that the only people allowed on the clinic floor are patients, minor children of those patients, and caregivers of disabled patients. Separating patients from family members and friends can be a delicate task. In some cases, they may panic, thinking they won't be able to find each other again. Reassure them that after they receive their care, all patients are directed to the family and friends waiting room to reunite with their loved ones there. As you separate these groups, be sure to request that the family members or friends hold on to the patient's bulky items, like blankets or folding chairs. Also, be sure the patient gets any medication or diaper bags or anything that they'll need from their family or friends. While it's not impossible to reconnect a family member with a patient while they're receiving care, it's not ideal, and we try to avoid it if at all possible because it's so disruptive to the care process. So at this point, basically tell patients they will not see their family members and friends again until after their treatment is complete. Number two, put corresponding armbands on patients and their children. This is one of the most important things we do. Every single minor must have a parent or legal guardian and a yellow armband. Each set of 2 armbands has the same unique number. You put one of the armbands on the child and the matching armband on the parent. Do not hand them to the parent or child, put them on. The idea to keep in mind is that if we see an adult with a child, they should have matching armbands. That way we know they belong together. So in the case of two parents and/or multiple children, here's what you'll do. Let's say there's a mom, a dad, and 3 kids. Put armband number 1 on one child, number 2 on the next, and number 3 on the third child. Then put all 3 matching armbands, number 1, 2, and 3, on mom. Then do the same for dad. Put armband number 4 on one child, number 5 on the next, and number 6 on the third. Then put all 3 matching armbands, number 4, 5, and 6, on dad. That way, either mom or dad can be with any of those children at any given time. When it comes to teenagers and young adults, this can be difficult to tell. You may just have to ask them if they're over 18, and in some cases, they will be. So just make a joke about how glad they'll be that they look young for their age on down the line. Number 3, put corresponding armbands on patients with disabilities who have a caregiver. Many patients with disabilities will attend this event. In some cases, a patient with a disability may require the ongoing assistance of the friend or family member they brought with them. We call these individuals caregivers. Caregivers are welcome to receive dental care if they want to, but in some cases they will not. A translator or signer that a patient has brought with them would also qualify as a caregiver. Caregivers are the only adults allowed on the floor, besides volunteers, who are not receiving dental care. In order to designate this, each patient and their caregiver must have corresponding armbands, just like you did for the parents and their children. In most cases, the need of a caregiver will be obvious due to a physical disability. In some cases, the patient has a developmental disability, mental illness, or a dental phobia. Now, though a husband can't accompany his wife for treatment just because she's a little nervous about getting dental work done, in some cases, a patient is simply incapable of undergoing dental care without a caregiver's support. If you have trouble determining the difference, just be sure to call on a lead for help. Number 4, gather, tag, and store bulky belongings. Unless they have family or friends to hold on to them, many of the patients will have bulky items such as heavy coats, blankets, and folding chairs that we'll need to store for them while they're on the clinic floor. Again, communication reduces anxiety. Don't just take their items. Let patients know that we do this so that they won't have to carry the items around all day, and that it keeps the clinic floor from being cluttered and from breaking fire codes. Reassure the patients that when they're finished with their treatment, they'll be led to the storage area to retrieve their belongings. You should only take the bulky items that they won't need until after treatment. Have the patients keep their purses, backpacks, diaper bags, medications, and such. They can keep their jacket or coat if they want to, but they can't keep folding chairs or large bulky blankets. We'll provide you with large clear plastic bags and a set of numbered blue armbands. You'll hold the bag and have the patients place the items inside it. Tie the bag and tag it with an armband. You'll then put the matching numbered armband on the owner again. Don't hand it to them, put it on. You'll then put the matching numbered armband onto the owner. Again, don't hand it to him, put it on. The next point is very important. No strollers are allowed on the clinic floor, no exceptions. This is a fire marshal rule, not ours, so parents must check in their strollers. While all other types of items should go into bags, in the case of a stroller or folding chair, you can place the armband directly on it instead of using a bag. If a patient needs more than one bag or item tagged, be sure to give them the matching armband for each item. Volunteers who are tagging belongings will hand off the bags to the other volunteers who will take those items to the storage area. Still, other volunteers will be stationed inside the storage area to keep watch over the contents. Number 4, distribute patient numbers. As they pass through the doorway of the clinic door, one volunteer at each door will be responsible for handing a numbered card to each patient. Adult patients receive a white numbered card, and children 12 and under will receive a lavender patient card because they'll be receiving care from the pediatric dentist. As you'll recall, the families with children who are receiving care come through the family clinic entrance. So if you're working at the main patient entrance, you probably won't be distributing lavender cards. Here are the only people who do not receive patient numbers. Number 1, caregivers who are accompanying disabled patients but are not receiving dental care themselves. Number 2, parents who are accompanying children patients but are not receiving dental care themselves. And number 3, children who are not receiving dental care themselves. They're just here because mom or dad is receiving dental care and doesn't have a babysitter. Number 5, hand off the patient directly to a runner. A runner is a volunteer who escorts patients. An important thing to remember at OkMoM is no one should ever be on the clinic floor without a runner accompanying them. This is for the safety and welfare of the patients, the volunteers, and the equipment. If you notice anyone without an OkMoM volunteer t-shirt wandering around the clinic floor alone, you should approach them and ask them how you can help them get to where they need to be. Also, if you see someone about to walk onto the clinic floor unaccompanied by a runner, stop them and firmly but politely ask them how you can help them. Once the patient passes through the doorway with the patient number in hand, they are taken care of by the runners from that point on. They're led to the patient waiting area where they're seated in order. On the seats are clipboards with medical history forms for them to complete and sacks containing bottled water and breakfast. So as you're talking to patients in line that morning, be sure to let them know that as soon as they enter the clinic floor, they'll be able to sit down. They'll have food and drink, and they'll have an opportunity to go to the restroom. Once we've admitted about 1,000 patients through the doors, we close the doors for the day. Now, depending on how many patients are waiting that morning, we may process all 1,000 by mid-morning. At that point, you may be asked to preload clipboards with medical forms or to prepare packed breakfast sacks for the next day, or you may be asked to serve as a runner. So it would be a good idea to watch the runner orientation video after this one.